Hello and welcome to our new topic. The focus now shifts toward the sympathetic system, which represents the body's adaptive response to stress and increased demand. Unlike the parasympathetic system, which maintains baseline stability, the sympathetic system prepares the body for rapid action. The drugs in this category do not simply activate receptors, they simulate a physiological state designed for survival. Understanding these drugs requires thinking in terms of urgency, energy mobilization, and coordinated organ activation. So, let's start. The learning objectives are shown. Please take a look. The objectives emphasize classification, mechanism, and clinical application, but in this context, they take on an added layer of importance because sympathetic pharmacology is highly receptor-driven. The ability to classify drugs according to receptor selectivity allows one to predict effects across multiple organ systems. Mechanism is not just about molecular interaction. It becomes a map that connects receptor activation to clinical outcome. This familiar diagram now takes on a different meaning when viewed from the sympathetic perspective, taking roots from thoracolumbar spinal outflow. Instead of focusing on balance, attention shifts toward dominance. The sympathetic system overrides resting physiology and prioritizes immediate survival. The contrast with parasympathetic function becomes essential, because every effect observed here represents a shift away from baseline toward heightened physiological readiness. The diversity of responses arises from receptor heterogeneity and tissue distribution. Adrenergic receptors, including alpha and beta subtypes, are not uniformly expressed, and their coupling to intracellular pathways differs significantly. This explains why activation of the same system can produce vasoconstriction in one tissue and relaxation in another. The key is not the neurotransmitter itself, but the receptor context in which it acts. This diagram illustrates the anatomical and chemical organization of autonomic transmission. The important point here is that while acetylcholine is used at the ganglionic level, norepinephrine becomes the primary neurotransmitter at most sympathetic effector sites. The adrenal medulla adds another dimension by releasing epinephrine directly into circulation, effectively acting as a hormonal amplifier of sympathetic activity. Remember that adrenal medulla embryologically replaces the postsynaptic neuron typically seen in sympathetic system. No wonder, the other name of sympathetic system is adrenergic system. The concept of fight, fright, and flight captures the essence of sympathetic activation. This is a coordinated physiological response that prepares the body for action by increasing cardiac output, redirecting blood flow to essential organs, and mobilizing energy reserves. It is not a collection of isolated effects but a unified state designed for survival under rage and stress. The effects listed here demonstrate how sympathetic stimulation enhances cardiovascular performance. Increased heart rate, contractility, and conduction ensure that blood is delivered efficiently to vital tissues. At the same time, selective vasoconstriction and vasodilation redistribute blood flow according to need. These effects are mediated primarily through alpha and beta receptors, each contributing in a specific and predictable way. The systemic nature of sympathetic activation becomes even more apparent here. Metabolic processes are accelerated, gastrointestinal activity is suppressed, and reproductive and ocular functions shift to support the overall state of alertness. The body essentially suspends non-essential functions while enhancing those required for immediate action. Catecholamines represent the core group of endogenous and pharmacological agents in this system. Their chemical structure determines their pharmacokinetics, particularly their inability to be administered orally due to rapid metabolism. This highlights an important principle. Drug structure directly influences route of administration and duration of action. The metabolism of catecholamines involves enzymes such as monoamine oxidase and catechol-O-methyltransferase. The first one catalyzes oxidation-reduction reactions, while the other catalyzes conjugative reaction. Look at the similarity to phase 1 and 2 drug metabolism. These pathways ensure rapid termination of action, which is essential for maintaining physiological control. From a clinical perspective, Understanding these pathways is important because drugs that inhibit these enzymes can significantly enhance or prolong sympathetic effects. In sympathetic system, drugs may influence synthesis, storage, release, reuptake, or receptor activation. This broad range of targets explains the diversity of sympathomimetic drugs and highlights that pharmacological control is not limited to receptor interaction alone. Both presynaptic and presynaptic targets exist. This sequence illustrates the life cycle of neurotransmission, from synthesis to inactivation. The key pharmacological mechanisms by which sympathetic activity can be increased are steps 7, 9, 10 and 11, as shown in this diagram. Direct activation of receptors is straightforward to understand. Indirect acting sympathomimetics generally act by releasing the stored neurotransmitters and would be covered in this lecture. Two additional indirect mechanisms exist. One is blocking the metabolism of catecholamines by drugs such as monoamine oxidase inhibitors, and the other is acting as the presynaptic alpha-2 adrenoceptor blockers. MAO inhibitors and alpha-2 blockers will be discussed with antidepressant drugs. The classification into direct and indirect acting agents introduces a fundamental distinction. Direct acting drugs interact with receptors, producing predictable effects. Indirect acting drugs, however, depend on the release of endogenous neurotransmitters, making their effects dependent on neuronal integrity and neurotransmitter availability. The differences between these two classes become clinically significant. Direct acting agents maintain consistent effects because they bypass neuronal mechanisms. Indirect acting agents, however, can exhibit tachyphylaxis due to depletion of neurotransmitter stores. Their effectiveness also diminishes in conditions where neuronal function is impaired. This distinction is crucial for both therapeutic use and examination understanding. The classification of direct-acting agents according to receptor selectivity allows precise targeting of physiological responses. Alpha-1 agonists primarily influence vascular tone, while beta agonists affect cardiac and respiratory systems. This receptor-based classification forms the foundation for rational drug selection in clinical practice. Since the dominant role of alpha-2 receptors is acting as a regulatory presynaptic receptors, no wonder we can use alpha-2 blockers, not agonists, but antagonists, to increase sympathetic activity. Note that alpha-2 agonists actually act as sympatholytics and are discussed with sympathetic antagonists. The vascular effects of sympathomimetics are widely utilized in clinical practice. Vasoconstriction can control bleeding and prolong the action of local anesthetics, while modulation of vascular tone is essential in managing hypotension and shock. These applications demonstrate how physiological principles are translated into therapeutic strategies. Sympathomimetics play a critical role in emergency medicine, particularly in anaphylaxis, where epinephrine reverses life-threatening physiological changes. In cardiac settings, these drugs can restore rhythm or modify conduction. The same receptor mechanisms are applied in different clinical contexts, illustrating the versatility of this drug class. The central effects of sympathomimetics extend into neurology and psychiatry, where they are used to enhance alertness and attention. In obstetrics, selective beta-2 agonists can delay premature labor by relaxing uterine smooth muscle. These applications highlight the broad reach of sympathetic pharmacology. In ophthalmology, sympathomimetics are used both diagnostically and therapeutically. Their ability to dilate the pupil and influence intraocular pressure allows for both examination and management of certain conditions. The diagnostic use in Horner's syndrome demonstrates how pharmacology can be used to localize lesions within a neural pathway, as mydriasis will happen only if Horner's syndrome is caused by a presynaptic lesion. Thanks for watching. For a more complete discussion, don't forget to watch our next lectures on sympathetic antagonists. Don't forget to like, subscribe, and share. Happy learning!